study nasal polyps. Nasal polyps are the edematous prolapsed masses, also described as bags or the sacs of mucosa arising from either the paranasal sinuses or the nasal cavity. Characteristics features of the nasal polyps. On seeing the nasal polyps, in appearance, nasal polyps are grey in color, glistening, it has a smooth surface and it is pedunculated. On touching with a probe, it is mobile, insensitive to pain, do not bleed as it is avascular. We can get confused with the hypertrophic turbinate as it looks like a polyp. So, the difference between the polyp and the hypertrophic turbinate are the polyp is pale in color, but the hypertrophic turbinate are pink in color. On giving decongestion, hypertrophic turbinate shrinks due to abundant blood supply, but the polyp do not shrinks. So there is no decongestion, but decongestion is present in the hypertrophic turbinate. Polyp is insensitive to pain. It is insensitive to pain, which is painless, but hypertrophic turbinate is sensitive to pain. When we touch with the probe, the patient winces with pain. On etiology, the polyps may be due to infection, allergy, and the polyp is associated with many diseases like asthma, allergic fungal rhinosinusitis, cystic fibrosis. If the patient is less than 10 years of the age with bilateral nasal polyposis, then we need to rule out the cystic fibrosis, because it is also associated with the polyps. Carter syndrome, Young syndrome. In Young syndrome, there is chronic rhinosinusitis, nasal polyposis, bronchiectasis, and the azoospermia. In Samter triad, we have aspirin intolerance, bronchial asthma, and the nasal polyposis. Polyps are associated with asthma. 30% of the patients with nasal polyposis have asthma. Aspirin intolerance. Here it is aspirin intolerance. 15% of the patients with aspirin intolerance have nasal polyposis, and 80% of the patients with cystic fibrosis have the nasal polyposis. Types of nasal polyposis: antrochoanal polyp and the ethmoidal polyp. Let's see the difference between the antrochoanal polyp and the ethmoidal polyp. Antrochoanal polyp, it most commonly occurs in the older children, and the ethmoidal polyp occurs in the adult. Antrochoanal polyp is also called as the Killian's polyp. It is called antrochoanal as it arises from the maxillary antrum. It is arising from the antrum, so it is called the antrochoanal. Choanal because it moves posteriorly. Firstly, the antrochoanal polyp arises from the maxillary antrum and it comes out into the nasal cavity and grows posteriorly towards the choana. So it is the antrochoanal because it is growing posteriorly towards the choana. As it is going posteriorly towards the choana, it has three parts: antral part, nasal part, and the choanal part. Here we can see this is the surgical specimen with all the three parts: antral part, nasal part, and the choanal part of the antrochoanal polyp. There are many theories due to which it is supposed that the antrochoanal polyp is developed posteriorly due to mucociliary clearance, which is directed posteriorly, and the inspiratory airflow is stronger than the expiratory airflow, thus pushing the polyp posteriorly. And the gravitational force pulls polyps towards the choana when lying down. But ethmoidal polyps grows anteriorly, so the ethmoidal polyp may come out of the nostril. Here we can see the ethmoidal polyp which is coming out of the nostril as it is growing anteriorly. Enterocoenal polyp is the single polyp as it arises from the maxillary antrum and which it arises from the maxillary sinus, which is a single sinus. And ethmoidal polyps are multiple in number because they arise from the ethmoidal sinus, and ethmoidal sinus has multiple air cells, due to which it looks like a bunch of grapes. Here we can see the ethmoidal polyps looking like the bunch of the grapes. As in enterocoenal polyp is unilateral, it causes unilateral symptoms like unilateral nasal obstruction, unilateral rhinorrhea, thick postnasal drip. As ethmoidal polyp is bilateral, it causes bilateral nasal obstructions, mucoid-to-purulent anterior nasal discharge, postnasal drip, hypoosmia or anosmia, facial pain. Enterocoenal polyp is mostly due to the infection, as we can see allergy, infection 1+ and the 3+. Because ethmoidal polyp is mostly due to the allergy, so the allergic symptoms can be seen like sneezing, nasal itching. For the investigation, we do X-ray paranasal sinuses and the non-contrast CT paranasal sinuses. We do non-contrast CT scan because it is avascular, plus 0-degree endoscopy, non-contrast CT paranasal sinuses plus 0-degree endoscopy. For the treatment, for the enterocoenal polyp, we need to do functional endoscopic sinus surgery, and the polyp should be avulsed totally from the site of the origin, otherwise it will cause recurrent. There will be recurrence of the enterocoenal polyp. But for the ethmoidal polyp, we can do functional endoscopic sinus surgery with medical treatment like intranasal corticosteroid spray. Oral steroid can also be given, but it can be given only for the short period of the time and it has many side effects. So we give intranasal corticosteroid spray with functional endoscopic sinus surgery. So in the enterocoenal polyp and the ethmoidal polyp. Enterocoenal polyp is single polyp. Ethmoidal polyp is the multiple polyp. Enterocoenal polyp occur unilaterally, but the ethmoidal polyp is bilateral. It is called enterocoenal, entero because it arises from the maxillary antrum, coenal because it grows posteriorly towards the coena. It is enterocoenal polyp is unilateral, so unilateral symptoms like unilateral nasal obstruction, unilateral rhinorrhea. In ethmoidal polyp, it has bilateral nasal obstruction like bilateral nasal discharge, and it is mainly due to allergy, so allergic symptoms like the sneezing, nasal itching. For the treatment of the enterocoenal polyp, we do functional endoscopic sinus surgery, but for the ethmoidal polyp, we do functional endoscopic sinus surgery and the intranasal corticosteroid spray. Here we can see the three parts of the enterocoenal polyp: antral part, nasal part and the coenal part. Differential diagnosis of the unilateral nasal polyp. If there is enlarged inferior turbinate, allergic fungal rhinosinusitis with boggy turbinates, inverted papilloma, juvenile angiofibroma, rhinosporidiosis, meningocele, encephalocele, malignant growths like squamous cell carcinoma and the adenocarcinoma. The complications of the functional endoscopic sinus surgery can lead to orbital trauma, and due to break of the cribriform plate, CSF can leak. It can cause bleeding and it can cause trauma to the turbinate. This is all about the nasal polyps. You can find these notes on the Telegram and the links are given in the description. Thank you.